Hey everybody, welcome back to Meta 360. I'm back again with another very interesting video in the diabetes series. Today we are going to discuss the different types of diabetes. I will go in great detail about type 1 and type 2 diabetes mellitus. But there are many other types of diabetes and I'm sure many of you will hear them for the first time. It will be very interesting, very intriguing, so stay tuned and let's start. But before starting, I would like everybody who are new to the channel to kindly subscribe and turn on the notifications so that you don't miss any other new lecture in the series. Every subscription, every like is highly appreciated. I thank you guys so much. Okay, so today we are going to discuss 9 different types of diabetes mellitus. Number 1, type 1 diabetes mellitus or insulin-dependent diabetes mellitus. Number 2, type 2 diabetes mellitus or non-insulin dependent diabetes mellitus. Number 3, gestational diabetes mellitus. Number 4, latent autoimmune diabetes of the adult, also known as LADA. Number 5, maturity onset diabetes of the young, also known as MODY. Number 6, ketosis prone type 2 diabetes mellitus. Number 7, type 3C diabetes mellitus. Number 8, post-transplant diabetes mellitus. And number 9, drug-induced diabetes mellitus. There is also another category of secondary causes of diabetes mellitus, such as secondary to diseases such as Cushing syndrome, acromegaly, glucagonoma, and pheochromocytoma. I will not discuss these secondary causes of diabetes in this lecture. We will discuss it somewhere else. So these are some of the types of diabetes mellitus. Now I will discuss each type one by one. I will discuss type 1 and type 2 in great detail, but I will discuss all other types very briefly. So stick with me and I hope that you will learn something new today. So starting with type 1 diabetes mellitus. It is a chronic autoimmune disease in which the autoimmune system destroys the pancreatic beta cells, resulting in absolute insulin deficiency, and this leads to hyperglycemia and its adverse consequences that include microvascular and macrovascular complications. The disorder results when a precipitating cause or event is superimposed in a genetically susceptible individual, and these genetically susceptible individuals are those who contain genes that have a higher risk of developing type 1 diabetes mellitus, for example like HLA-DR3. Let me explain this genetic predisposition by giving an example. Alex is a 15-year-old boy who is genetically predisposed for developing type 1 diabetes mellitus. This means that he is having genes that have an increased risk for developing type 1 diabetes mellitus. These genes include HLA and non-HLA genes. The HLA genes have been identified, and these are HLA-DR3, HLA-DR4, DQ8, and the non-HLA genes are mostly the immune system genes. Now in Alex, who is genetically predisposed, a precipitating cause or event will lead to the autoimmune system dysregulation, resulting in the autoimmune destruction of the pancreatic beta cells. These precipitating events are largely unknown, but some theories exist, which includes a diet in the infancy, viral infections, especially enteroviruses, and alteration in the intestinal microbiome. So, in a genetically predisposed individual, any precipitating event can lead to autoimmune dysregulation and autoimmune destruction of the pancreatic beta cells. And this is the pathophysiology and pathogenesis of type 1 diabetes mellitus. Before going any further, I would like to discuss the normal glucose regulation and the role of pancreas. This is a very important concept because without knowing the normal physiology, it is almost impossible to learn about diabetes mellitus. The pancreas in the human body contains a cluster of cells. These clusters of cells are known as islets of Langerhans. This is a very important structure and it contains the two most important cells for the glucose regulation. These include the alpha cells and the beta cells. Now, to maintain a normal glucose level, there is an interplay between the glucose level and the alpha and beta cells of the pancreas. So what happens that when there is an increase in the blood glucose level, for example, after taking a meal, the beta cells are stimulated to secrete insulin. And this insulin in turn results in the uptake of glucose by various cells, resulting in decreasing the blood glucose level and ultimately maintaining a normal blood glucose level. On the other hand, let's suppose the normal blood glucose level is decreased. Then the alpha cells in the pancreas are stimulated to secrete glucagon, which results in an increase in the blood glucose level and ultimately maintaining a normal blood glucose level. So this is the normal physiology of blood glucose regulation. Now let's talk about what happens in type 1 diabetes mellitus. As we have already discussed, in a genetically predisposed individual, a precipitating event can lead to autoimmune dysregulation, resulting in the production of autoantibodies against the pancreatic islets of Langerhans cells. And this results in the destruction of the beta cells to such an extent that it ultimately results in the absolute deficiency of insulin. And when there is no insulin in the body, the glucose cannot be utilized properly, resulting in elevated blood glucose levels or hyperglycemia. So, to summarize, type 1 diabetes mellitus is an autoimmune disease in which our immune system it start targeting our own pancreatic beta cells, resulting in insulin deficiency and resulting in hyperglycemia and all its adverse consequences. I hope this concept is now clear to all of you. Before going any further, for the sake of completion, I will also talk about the autoantibodies that are produced that results in the destruction of the beta cells. Sometimes these autoantibodies are tested in the board exam, so these needs to be memorized. The autoantibodies that produced against the beta cells include antibodies against glutamine acid decarboxylase or GAD, antibodies against insulin, antibodies against islets antigen 2, and antibodies against zinc transporter 8. These are some of the antibodies that results in the destruction of the beta cells and ultimately the absolute insulin deficiency. Dear people, I originally planned to cover all the 9 types of diabetes in this video. But as I start discussing type 1, I realized that going into the necessary detail made the video much longer than I expected. So to keep things concise and engaging, I will split these into 2 or 3 parts. In this video, we have covered type 1 diabetes in depth, and in the next part, I will continue with the remaining types. So stay tuned for part 2, it's coming soon. And don't forget to like, subscribe and share this video with your colleagues and friends. Till then, take care and goodbye. See you in the next video.